community today. Dr. Karrie Grear is here with New Hanover Regional Medical Center's Physicians Group with Neurology.
Yes, sir.
And we're going to talk today about ALS, also known as Lou Gehrig's disease. And we were talking off camera. One of the things that I was unaware of, there's two kinds, and I'll let you dive into this, but only one is genetic.
Yes.
There are thoughts the other may be.
Maybe genetic. So there's the familial form, which we all know about. It runs in families. There's a strong genetic predominance with it. And then there's sporadic, which is about 90% of people. Even though we haven't figured sporadic ALS out yet, we do think it may have a genetic link to it.
And we're talking just huge number, 20,000
20,000 people in the United States at any given time have been diagnosed with ALS.
And we were talking again off camera, many of the viewers out there, and for those of you that don't know, co-anchor Kim Ratcliffe, her brother, Keith Kopka, was very open as he went through this and eventually succumbed to it. We saw the struggles. What is life like for an individual?
So life can be difficult with ALS. One of the first symptoms of it is a painless progressive weakness. So sometimes people get weakness in their legs, sometimes they get weakness in their hands. And then the weakness just continues to evolve and becomes more and more, and so that it encompasses more of their body. There's also a specific subset of patients with ALS who, instead of getting weakness, get problems with their speech or problems with their swallowing, and that's their first symptom.
Is that part of what is so troubling about this? Is because I don't want to say it's silent, but that it can come on so slowly to where you might not think you have a problem.
That's very true. And not only that, but initially the symptoms can be very mild and it can be hard to diagnose. And so that makes it difficult too.
Once it is diagnosed, walk us through what you're able to do as a physician.
So right now there is no cure for ALS. We do have some treatments for it that can prolong people's life, but basically we try and treat the symptoms. The goal of treatment is to keep people safe and keep people at home for as long as they can stay there.
When an individual is diagnosed, from diagnosis to passing, are we seeing, though, that is starting to elongate? Are we getting a longer lifespan out of it?
So everybody's a little different. Sure. Some people have a really short time from when they're diagnosed until they pass, and some people can live 10 or 15 years. So it just depends on the individual. But we are seeing in some cases with some of the new medicines that people are living months to maybe a year longer.
I was going to say, with so many questions about this, what is it, where do we see the positives right now as far as research?
Well, so as you're probably aware, there was the big ice bucket challenge last year, and so the ALS Foundation, ALS Association, raised a whole lot of money for research, which is absolutely wonderful. So now we can have all this money to do all this great research and hopefully work towards a better cure for the disease.
And as we always say on here, if you have any questions about today's topic or anything medical related, don't email me. She wears white, I wear blue. She's gone to school for it. Doc, I appreciate the time.
Thank you. It's a pleasure.
We're back with more after this.